I'm off now, and I'm taking the car.
Morning, Rachel. Morning.
Morning. Oh, nice lycra.
Sorry, I didn't have time to change. Good to see you two are raring to go.
Yes.
Yeah, Rachel's on her way. I've just passed her jogging with a cigarette.
Great start.
Speaking of changing, here's your fat suit, Sally.
I thought I was fat enough. Clearly not.
Let me just get out of this stuff and get set up.
Sorry, I'm late.
You all right?
Yeah. Ooh, 2 cameras. Very professional.
Oh, yes, darling. That's for our close-ups, don't you know?
Couldn't you find an actual obese nurse, Hugo?
Well, I guess that would have been difficult. Hey, you're fat. Do you want to star in a film about fat and unhealthy nurses?
Something like that.
Hey, do I get to wear one too?
No, Sally's acting someone else. It's based on a load of interviews I did with a load of other nurses. But you kindly consented to tell your own particular story for the film. Is that still okay?
Yeah.
And I get to do my big confessional about smoking.
Yes, thank you.
I'm not going to be able to do anything in this.
Well, I think that is the point, isn't it, Hugo?
Exactly. We know 1 in 4 nurses is obese now, and that obesity is the 2nd biggest cause of preventable cancer after smoking, so nurses should know. Sorry, I meant to keep my opinions out of this.
Oh, no, you're right. I know loads who can't even bend down to help a patient put on their shoes.
Says Miss Skinny.
I know I've got a spare tyre, but mine's more mini Clubman. I mean, this is a ruddy great trot. Look at this. I'm exhausted already.
And the good news is you now have to put it on under your uniform.
Oh,
Excuse me.
Yeah. While we're waiting, I'll just reframe and let's try the intro. Well, thank you all for agreeing to be part of this research film project. As well as the video diary camera in your homes, I'll be filming you out and about for a few days of your lives, just to see what stresses and strains.
We can show you plenty of those.
Of course. And importantly, the obstacles, the cultural phenomena that prevent you and so many of your colleagues leading healthier lifestyles.
Well, where do you want me to start? Nurses are shat on, well, literally, on a daily basis.
Josie, I can't use any of that now, can I?
Ta-da!
So, what kind of a study is this then?
It's called ethnography, a study of a particular group, in this case, nurses. I'll be recording your behaviours in certain situations, at work particularly, but also at home, so that the powers that be can possibly implement some changes. But as importantly, I hope you as individuals and your colleagues will be inspired to make some changes too, which will come up with our group discussions.
Good luck with that. I'm no expert.
I'm starting from the premise that hospitals and other medical settings are not in themselves obesogenic or
Obese
inherently-
what?
Sorry, tending to cause obesity. My point is, if these environments were obesogenic, unhealthy, then why aren't physios and doctors also obese? I mean, you know, just for example.
Right, so where do I start? Doctors and physios can walk away from the patient and the ward. Our relationship with patients only ends when they are discharged or die. We are left to pick up the pieces, so it is no wonder that our health gets abused. And do not get me started on how we are treated on a day-to-day basis. We don't get breaks.
Okay. Yeah. All right. Just straight to camera then, please. A little bit about how you got into nursing, just everyday lifestyle. Use your own story for this. It's just to get you used to being filmed.
Are you sure? Once you get me started, I might not stop. Well, I trained at Southampton General way back in, well, we're back in the days of bed inspections, wearing awful American tan tights and smuggling your boyfriend in and getting him to pee in a milk bottle. Yeah, we put on a few pounds. I mean, even the dressmakers then that made our uniforms, they said we'd be back for larger sizes, and we were. It was all treacle sponge and custard in the night canteen, because that existed then. And I even remember once, we were finishing off someone's milk tray as we were laying them out. Oh, do you know, patients still don't give nurses healthy stuff like fruit. They should put a sign up saying, please don't feed our nurses unhealthy snacks, like at the zoo. Oh, yeah. And after years of yo-yo dieting, I've been on the ice cream diet. That was a lot of fun. The fibre plan, that wasn't. Oh, yeah. And at my age, well, there's no hope for me.
You're only 59, Sally. Hardly old.
Yeah, but...
Yeah, but?
I know.
Right. Can you start reading the script now? This is based on an interview I did with a lovely senior nurse practitioner up in Manchester.
Oh, I worked in Manchester. I love it there. I remember I was on this home visit one. Right. Anyway, I'm in the community now, regular hours, but I can still grab food when I can. Is this all right? My car's my canteen now that I'm out and about. Do you know, this is so me. My car's a skip. I empty all the wrappers on a Sunday night, ready to top them up again the next week. Disgusting, I know. I've got no time for food prep, though. And, you know, I reckon I keep all the local 7-Elevens in business. It's dreadful when you come to think of it.
Sally, this is your own life again, isn't it? Can we get back to the script?
Sorry. And my husband doesn't cook either. Nor mine, though. Do you know, if he's heating up last night's biryani takeaway, he thinks he's won MasterChef.
Script.
Sorry. Weekends, we'll take my mum to a garden centre for an all-you-can-eat Sunday lunch. She's had breast cancer now, so I think every day's precious with her. Bless. We slob in front of the telly a lot, picking really. Then it's back to Monday and we do it all again.
Script, Sally.
And it's difficult to change the nature of a nurse. We are pre-programmed to put others first and just eat. I do feel bad though. Well, even earlier today I was making every contact count, giving our spiel to this chap. And this is just me today. I was making every contact count. I said, Tom, do you know, it would really help your fitness as well as your loneliness if you say swam, walked 20 minutes a day, 5 times a week. We'll give you an extra 2 to 4 years with your grandkids. And a reduction of 20 to 40% on up to 22 diseases. And he gave me that look. Yeah, it says here too, he gave me that look. I know that one, because I'm no role model. Probably carrying around with me a 4-stone alien with me each day. I blame mine on that first box of Terry's All Gold on Wilson Ward. But how do you undo a lifetime of bad habits? I really got into that one. Was that all right?
Thank you. Great detail.
Oh. Hi, love. Stroganoff for tea.
Baby steps.
So, I'd like to hear from you guys today. What are your ideas to help your fellow nurses be healthier?
Improve morale. No one believes in us, so we don't either.
Yeah, we all know about input and output, but it's very difficult when you're exhausted and not valued to value yourself. Stop fat-shaming nurses. We need more open, supportive discussion.
It's true. I mean, we all talk about death, don't we? But fat is our taboo.
So many of us secretly just want to lose weight.
And then it's nights and we order in pizza.
Why?
I'm joining in.
Comfort.
Can you put your own health needs first? Create a different culture, dare I say?
Well, it's difficult to make change without a specific motivation.
Being health messengers for your patients isn't motivation.
In my experience, people will do hard things if you help them to.
So how can we help?
Well, get management to sort out the franchises. Only allow them to serve healthy food.
Sally?
Well, I'm so busy starting then failing on diets, I'm no expert.
Oh, this isn't a diet, but...
Oh, well, actually, Lucy made us all this amazing omelette on last night's in minutes.
Okay, so simple changes then. What about a fitness program?
I love Bollywood. Well, I've certainly got the equipment for it.
I found it. It's an app. Nursing You, it's called. The WIN Project. Healthy Weight Initiative for Nurses. Shall I sign us both up, Sally?
Would that work, say, for you, Sally?
Seize the day. These are going in the bin.
Oh, bloody video diary.
Early.
What? It's my nightcap.
It's 9 a.m.
I can still tell the time, even after 5 bloody nights, just. Look, I had a shit night. I just need to unwind, okay? What?
You promised.
Don't you think that I want a normal life too? To have our baby?
Do you really?
I'll just piss off back to work. Well, the other thing that's annoying is that you don't see management coming out when, yet again, there is nobody safely for me to hand over to. And I am left there till God knows when. And then I'm left taking it out on my husband and the rest of the staff too. And those stupid bloody rules about water bottles. Where are the rules that protect our breaks and right to refuel? Do you know, one of my nurses carries glucose tablets in her pocket. She fainted on shift the other week. Civilised country.
You said in your questionnaire that you drink to unwind.
Is it any wonder? I'm too exhausted when I eventually do get home to bother faffing around even boiling a kettle. Or I'm just so pent up. I need to pour that glass of wine to switch off those feelings and eat that slice of pizza to reward me.
You stated on the form that the amount you're drinking does concern you.
Yes, but...
Yes, but...
I know I said that I was happy to be part of this project, but I hadn't realised what it was going to bring up.
Actually taking time to think about yourself and your health.
Well, yes.
I'd like you to keep a diary of your drinking and of why you had that drink, if that's okay?
And that's supposed to help me magically cut down by writing it down.
Well, it's just for the research, but also, yes, it's a start.
Okay, I will. I've worked really hard ever since I was 18 to run my own ward, to do a good job, and to run it the way I feel best. I do love nursing, but sometimes I just want to run away.
Run away from...
All of it.
That would be so sad.
My husband's a nurse too. I know, double whammy. Most shifts, I feel like I'm just holding a scream inside. So is it any wonder that I reward myself with a drink? That's just how it is. I know that without a doubt, I am raising my chances of dementia, blah, 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 and increasing my chances of ever having a tranquil family life, a family full stop.
Have you got children then, JC? So how can we help nurses reduce their alcohol intake?
Well, it should be covered in our training. Other coping mechanisms for stress, not just blowouts. Well, same for smoking.
And that for those of us that drink now, well, use breathalyzers on the wards.
Harsh.
Well, they're talking about doing MOTs for nurses and their fitness to practice for weight, so why not drink?
Dictatorship. I would never impose anything on my nurses that I could help. Everyone has to find their own reason for cutting back. It just goes back down to culture. Nurses just need to value themselves.
Yeah, without having to, well, eat crap, smoke or drink to help ourselves feel good.
So how could that drink be replaced then?
Well, it's hardly rocket science, is it? Well, it's like your mindful thing again, Josie. Habits, eh? Who'd have them?
So bad habits can be replaced by better ones, can they? And you're a sister. Could you lead by example? Create a new social norm?
Well, like non-alcoholic cocktails after work?
I don't know what else would give me that sense of relief.
Well, if it helps, I cut down with my Dave when he got high blood pressure. You need to find a reason to do it, a replacement, and people to do it with. Oh, get me. I should be in charge.
Today, I want you to close your eyes.
Promising.
Close your eyes and conjure up the vision you hold of yourselves now. Now I want you to keep your eyes closed and envisage the healthy, best version of yourself you aim to be. Find your own trigger for change.
Coming, Mrs. Winters. Yes, her results have just come back in. Her alanine aminotransferase is 32. Her creatinine levels are 45. Coming, Mrs. Winters. Again.
Hang on in there.
Yeah, you're right. Well, I'm lucky. Soon I'll be qualified, so I'll have a bit more money. It's been hard, though. Well, I can't believe they throw away all that food in the canteens. I mean, they should give it to the nurses to take home at the end of their shift. Smoking keeps my appetite at bay, saves me money. Yeah, I know there's no logic in that. When I was an air stewardess, we weren't allowed to eat the extra meals either, but at least we were paid more then and got to see better sights, better than bodily fluids all day. Well, actually, to be fair, we got to see our fair share of those as well. You'd think I'd learn.
So, have you made the right career choice now?
Oh yes, I love being a nurse. Where else do you get to do the simplest of tasks? I don't know, like putting someone onto a bedpan. That intimate care where you really get to know them. Well, you know that they feel that you're on their side. It really humanises a patient. I love that. Less drunks on board too. Oh, well. But we didn't have all those sugary snacks there. I mean, on the wards at night, I can't believe it. It's like a culture that we're expected to eat all that sugary stuff. Crap, to keep our energy up. So, you know, when we hit that brick wall at 5 a.m, when we all know that a handful of nuts or a banana is the answer. Just habits, I guess. Even I've eaten lasagna at 4 a.m. because you don't know when you're going to eat again. You just eat as much as you can in half an hour. Go, go, go. It's mad. I guess we just all follow the nurses just above us. We don't break the mould. Smoking calms my nerves. I've had some close shaves going home after a late. Well, feeling stalked? I know it's ridiculous, but with a cigarette in my hand, I just feel more confident. Well, in all sorts of circumstances, actually.
Do you not get any training?
There isn't any training module about self-care on mad shifts, mad people. So nurses just think they can manage everything until they find they can't. And, well, I guess that's what's happening now. That's what we're seeing now in what you say, overeating, smoking, drinking, and no one's leading the way.
You seem as if you could.
Me?
Yeah, lead the way.
Nurses are seen as followers. Doctors are the leaders.
Couldn't you change that?
What? Form a healthy eating, less drinking, non-smoking club. No one would recognise me.
So, you think this is going to be your career for some time now?
Oh, God, no, I don't want to retrain again. Or ever leave nursing, actually.
So for the next 40 years?
40 years? How old do you think I am? I'm 32 already.
Sorry, of course. I don't mean... It's just... Your body won't be able to remain healthy with your current habits. Sorry, it just amazes me that young, intelligent women like you, and male nurses too, right, who all see the carnage reaped from unhealthy living habits daily, the diabetes, the cancers. I'm just beginning to take stock myself. Because my own mum, anyway, I don't need to tell you all this. You know the stats, you know the data.
It's difficult to change the nature of a nurse. It's all consuming. We're in this bubble of nights or whatever together. Yes, we know the stats. We've learned them by heart. Every day I smoke after age 35, I lose 6 hours of life.
Hashtag healthy nurse could start today. It just takes one nurse to lead the way.
Yeah, but...
Yeah, but...
Yeah, okay. But we need releases. Smoking is the way I cope. Draw breath, literally. Everybody needs a nurse, but nobody champions us. All these programs following junior doctors, paramedics, nothing about nurses. It doesn't help that we're not valued by others. Do you know, a nurse from my intake committed suicide recently. I know, and there's plenty others with anxiety problems. I smoke. It helps for now. I mean, soon I'll be qualified and all that support I've had will disappear, and that worries me even more.
So you'll need to find other, healthier support systems, other than smoking, I mean.
Nurses are very practical people. We just keep going.
Is it healthy to be that sacrificial? Sorry, what do you do with your time off? I mean, hobbies.
Well, there isn't much time for anything, what with studies and assignments. But from now on, I don't know, I like the movies.
What was the last movie you enjoyed?
Mamma Mia.
Oh, God, I hated that.
Well, you did ask.
Oh, yeah, I did, didn't I?
I hate role plays.
Well, Sally, as you're a pro,
What are you saying?
you be the nurse, and Rachel, you be the manager. Here are your scripts, but feel free to improvise.
So, before you go, there's just one issue I'd like to raise.
Yes.
We're finding that many of our nursing staff that are overweight are benefiting from attending slimming clubs. And I have some vouchers if you're interested.
Are you saying I'm fat?
Well, not in so many words.
How many words do you need?
Go on, keep going.
Well, you need to say to yourself, my well-being is crucial. Otherwise, I will end up dead.
Oh, whoa.
Well, think of this as an MOT for nurses to see if they are fit to practice.
I do carrots, not sticks.
Well, okay, why do you overeat?
My weight is my business, and should I decide to do anything about it, I'd make my own arrangements. I mean, you can stick your slimming clubs.
Sorry.
Sally, are you okay?
So I forgot we were doing role play. A bit of me came into play there. It's just such a personal thing, isn't it?
Well, it's not as though you're really overweight.
Thanks, but I have been for years. It's just facing it, isn't it?
It was projectile all over me.
Okay, moving on.
Yeah, well, how are we going to finish the film positively without Sally in it?
I've got the footage, and we have you two. So now can we just do a read-through of all the Birmingham nurses' suggestions first? Quick fire style, okay?
Right. Find other ways to unwind.
Take up some exercise you enjoy and that fits around your work and family.
Just deciding to start today and then do it.
Hang on to the vision of a healthier, happier self.
Relatives could give donations to a pay-forward system for thank yous that we could all decide on, like a bean bag for the staff room or whatever.
Instead of sweets. All the chocolates that I have eaten over the years, even strawberry creams, and I hate them. Oh!
Hospitals arranging group exercise or yoga on site.
Managers insisting on breaks, including mindfulness minutes in the day, maybe at handover, instead of escaping off for that fag or whatever.
Busted. That was for me, wasn't it? Maybe health checks in hospital, so you can get your nicotine patches on site.
And subsidised healthy tea trolleys coming onto the wards day and night. This project has got me thinking.
Oh dear.
Seriously? Ward sisters like me, we need to lead the way, setting the standard, the expectation, saying that this is how our team works. And on this ward, we are going to work to keep each other fit and healthy for work emotionally and physically.
Great. What will you do?
Speak to my fellow ward sisters and put this on the agenda for departmental meetings. This has got to be sorted by up above too.
Amen. Well, what about asking nurses to volunteer to slim or, yes, give up smoking with a group of patients as a sort of leader?
Yes.
And you visiting us regularly would help the most.
That'll definitely help. Oh, but that's it though, isn't it?
Well, we've got one follow-up filming session in 4 months. I'll email you dates if you're both okay with that. Great. Well, let's film that properly now then, shall we?
Can I just have a quick break?
Thwart that craving with a bit of positivity, Rachel.
Oh, okay, I'm thwarting.
Right, so today I thought we could have a look at what we filmed so far. Here you go, it's all set up.
Do I have to? I hate watching myself. Being on screen puts kilos on you. I've already put a copy of this up on my fridge door, so before I reach in there, I think twice. I use the Nursing You app, and that has been great for helping make new habits, and I have an accountability buddy to keep me to them. I started a staff WhatsApp group so that we dump stuff there from each shift rather than taking it home. And I think that I'm going to share some of the dump stuff with management so that everyone else feels listened to. And we're encouraging each other
to do mindfulness breathing. So that's 2 minutes per break, even if it has to be in the linen cupboard.
Oh, I told you. But you are going to look like a film star. You wait.
I sound so preachy.
We've got to get the message across. Your turn, Rachel.
You see this aged photo you so kindly printed out for me, Hugo? Well, I see it every time I put my makeup on, and I'm reminded why I'm going through this. I've linked up with 3 other almost former smokers, and we still meet outside at breaks, but we smugly pat ourselves on the back instead and compare our running times. Told you.
What I look like.
All right, we're going to take some suggestions from some of your colleagues in Sunderland. So, Josie, could you go first?
The French say that our relationship with food is like a loveless marriage. So, love your food. It's not just fuel.
No more grabbing service station sausage rolls. Treat yourself to a smart cooler bag. Fill it with, say, chicken satay.
Make lists of what you enjoy most and is good for you and stock up. And on those days that are hardest, reach into the freezer for just that. Create the conditions for success.
Variety is the spice of life. So, on night duty, bring and share from different cultures to treat your taste buds. Make some changes.
Planning. Let rules be your friend and then repeat them to be your new best friends. New habits.
Good job. Do you know what? I think we're done. Yeah. Oh, and I've got presents for you. Here's yours, Rachel.
Have you? Oh, what the?
Vision boards. So you can encourage other nurses to be leaders in this way too. Enable them to believe they deserve to be healthier too.
You are so wise. Don't you think so, Rachel?
So put up goals and ideas, how to reach them, the what, when, where, how. Mantras, right? Local slimming and exercise classes, healthy food outlets, meal tips, whatever you all find useful. I've put on a few there just to start you off.
Right, be a nurse ambassador for health. Start today.
Well, we're doing that.
Yeah.
Practice what you preach to your patients.
First impressions count. We all know that.
Find an accountability buddy for meals and exercise. Now, I already do that.
Well done. Sign up for a walk or run, then you have to do it. Well, I've signed up for a run with a group of people.
Work-life balance, I'm still working on that.
Tricky, that one. Walk away from diabetes. Yes.
Everybody achieve every day.
Increase your fruit and veg, decrease weight and risk of colon cancer by 50%.
Oh, join Josie and Rachel in Ward D day room on...
Da, da, da. We could have it once a week.
That would be wonderful.
It doesn't matter where you start.
It's where you finish.
Hooray!
Okay, what about yoga then?
Oh, yeah, but...
Yeah, but...
Okay, you win.
Hey, you're back.
Sorry, I didn't know whether you were filming or not.
Great, come and join us.
Hi.
Hi.
Well, Hugo persuaded me to come back to focus on something positive.
Well, that's the point, isn't it?
You didn't tell them then, Hugo?
No, it was your news. Are you okay if I keep the cameras running?
Yeah.
News?
I've got breast cancer.
Oh my God.
Don't be nice to me now.
So that's why you dropped out?
Not entirely. I guess I was hiding behind old habits. And, well, ironically, I've now got my motivation to be healthy.
Some motivation.
I should have done it sooner. I've got op, chemo, radio, and apparently even a holiday from being overweight helps. I'll pretend it's the Caribbean.
Good for you. You look great.
Well, I haven't had anything done yet. Op's on Thursday. But at least I'll be skinnier for the surgeon.
It suits you. How much have you lost?
Half a stone. I usually trough when I'm upset, but Well, I just was determined to be healthy for once. And my Dave says he wants a slim, sexy, bald woman.
Do it for you.
Yeah. I am for once putting my own health first so I can be there for Dave and the boys and everyone else. Anyway, what about you, Josie?
Well, I've lost a stone.
Oh.
Too, and my partner has.
I thought so.
No more drinking during the week. Just a glass or two of a weekend if we're not working now. It means I've got much less munchies, which is good. And I've got to admit that I am feeling better, more energy, not so stressy at work.
Well, that's good to hear. Joke.
And how's the quitting smoking?
Moving on.
Anyway, so I haven't come here for nothing. Where are those scripts then?
I think what you're all saying is far more powerful, if you don't mind.
It's fine.
Well, we're putting all of our wine money into a holiday or baby kitty, whichever happens first.
Oh, that's lovely news. What a great aim.
Oh, God, no, that would never be my motivation.
So what is?
Well, I have got one idea.
About time.
Is that a wrap then, as they say?
Yes. Well done, all of you, for being well on the way to being the best you can be, and hopefully encouraging others.
Well, it has been really interesting, and we've all enjoyed it, haven't we, girls?
Oh, definitely.
Well, it's also meant a lot to me personally to also hopefully prevent nurses, of all people, getting preventable diseases. And, well, it has been a real pleasure working with each and every one of you.
Aww.
And we've got something for you, haven't we, Rachel?
Oh, yes.
No, really?
Here we are.
Oh, thank you so much. That's really... Okay. Oh, that is so sweet. Thank you. I'll really treasure this.
And because it is the end, why don't we have you in the last shot? Come on, Hugo, let's take a selfie.
Oh, all right then, hold on, I'll just... Yeah, this is definitely going to be lost in the edit. All right. Okay. So, Oh, right. All right then. So everyone, just look into this one here, and say cheese.
Oh, no cheese, we've got a new mantra.
You're right. You're right. Okay. All right, ready? Yeah, no, but. No, yeah. No, yeah, but. So,
Celebratory drink?
yeah, but.
Yeah, but what?
But nothing.
Right answer. Come on, I'm buying.
All right.